Right now. Go ahead, hon.
I'm going to stop sharing for a moment so we can see each other's faces a little bigger while we do our introductions. And hi, everyone. My name is Mika, doula Mika Cade, and I am a member of Shifra Circle Community Doula Program, which is a program of the Oakland Better Birth Foundation. And this is our childbirth education series, and this is our two-part series. And I'm happy to have you all here this evening, and I'd love to start with some brief introductions. I guess I could introduce myself first. Other than my name, I've been a doula for almost 6 years now here in the Bay Area, and about, what are we saying? Is it 3 or 4 years ago? I don't even know how long ago now. I started working with Samsarah as her assistant and gained a lot of experience through that. I also do virtual pregnancy and postpartum coaching as well. So what I was thinking is that everyone, we wanted just to do brief introductions so you can, share your name and whether or not you're a doula or a student doula or a pregnant person and where you're located. And whoever would like to start is welcome to.
I'll start. Hi, I'm Jessalyn. I am a doula with Shifra Circle and a childbirth educator, and I'm also Mika's friend and colleague in doing virtual birth support. And I've been working in the Bay Area since 2012, 2013, 2014, somewhere in there. But I just this weekend finished transitioning to Eugene, Oregon, where I am right now. And I'm happy to be here. Thanks.
Thank you.
I'll go. Hi, guys. I'm Kathleen. I'm a doula, and I'm part of Shifra Circle and Oakland Better Birth Foundation. And I've been a doula for 5 years, and I'm a mama. And I'm so happy to see a baby on the screen. Welcome. And I am always excited to get to see my colleagues teach and learn from them. And Mika always shares something new. So I'm looking forward to it.
I'm Julia. I am a doula with Shifra Circle and also with my own business on the side. And I've been doing it for about a year, so I'm pretty new and still gaining a lot of experience and knowledge from other people, which I am happy to continue doing, which is, I think, part of the reason why I like doula work so much, because it's ever evolving and you can always learn more skills and stuff. I also do floral work on the side, so I've been doing floral for weddings with other florists and doula work for the last year and a half or so.
My name is Samsarah Morgan. I'm the executive director of Oakland Better Birth Foundation and Shifra Circle Community Doula Program and the Better Birth Association of Harlem, New York that just got born this week, a brand new baby organization. I'm so excited to be here for this class. It's been a pleasure. I've been a doula for 40 years. I'm a mom, I'm a grandma, I'm a mom-in-law, I'm a lot of things. I'm happy to be here and looking forward to learning more from Mika.
Hi, my name is Priscilla. I am a doula with the Oakland Better Birth Foundation and Shifra Circle. And I am happy to be here as well. I might be going off to the hospital soon, so I'm gonna be here as long as possible to learn from Mika. So.
Hi, I'm Zaria. I am a student doula, not official yet. However, I've been part of Shipper Circle like since February of this year. And like many people are saying, I learn so much every single time I'm in class, like luckily from Samsarah and what everyone else has to bring to the meetings. It's always just so interesting to see everyone's perspective and their experience and from their different walks of life. Yeah, I just recently graduated from undergrad college, and I'm interested in being a doctor. However, I'm like much more interested in holistic medicine and internal practices and just natural methodologies. So I think like being a doula is just like something that has always stood out to me. My aunt's a doula. I know a lot of like doulas in my family. So yeah, I love it here and I love being part of it. So thanks for always opening the space, and thank you for teaching us today, Mika.
I'm Brooke, and this is Camille. I'm also a student doula, although a long-time student doula. Also just been working and also a student at community college. So I'm really taking my time with the certification and also being so yeah, I'm excited to be here. I trained with Samsarah and Mika, and Jocelyn has been a great mentor and along the way. So glad to be here tonight. And so is she.
Cutie. Great. Thank you all for your introductions. I wanted to just go over our agenda for this evening quickly so you have an idea of what we'll be covering. I also wanted to mention to the student doulas especially, a key part of what we do through Shipper Circle, which is maybe a little different than other doula programs, is that we do provide childbirth education. And so it's really important that you look at the teaching that I'm doing also through that lens, because this is some of the work that we'll be asking you to do with clients. So for today, we've done our welcome and introductions, and we're going over the class. And shortly we'll start with pregnancy and specifically looking at the 3rd trimester and talking about nutrition. We'll then talk about labor and the stages of labor, and we'll end with comfort techniques. Next week, we'll talk about interventions, C-sections, newborn and postpartum care. Any questions about the agenda?
Looks good.
Great. I'll have time during, I will stop for questions kind of throughout the time. And if you need to take a break, I understand completely. So don't worry about that. So we're going to start with a short video on pregnancy and then get into it from there. Oh, you know what? Let me make sure. All right, optimize the sound. There we go.
Pregnancy lasts about 40 weeks and is divided into 3 trimesters. Let's focus on the 3rd trimester. It starts at week 28 of your pregnancy and ends with the birth of your baby. During these final weeks, your baby continues to grow and develop. When you are between 39 and 41 weeks, your pregnancy is considered full term and your baby is ready to be born. If you haven't had your baby by 42 weeks, you're considered post-term, which is also normal, but your healthcare provider will probably keep a closer eye on you and your baby. Babies born from the 37th week to the end of the 38th week are considered early term. Early term babies are still at a greater risk for breathing, feeding, and other medical problems. It's usually healthiest for the baby to be born at 39 weeks or later. During the final trimester of pregnancy, your baby's brain continues to develop. In fact, it practically doubles in size and adds brain cell connections needed for balance, coordination, and learning. Also, your baby's lungs are still forming, and he's gaining the fat that will help him stay warm once he's born. So even though you may be uncomfortable, be patient. The health of your baby is worth the wait. It's helpful to understand what's happening inside your body during the 3rd trimester as it prepares for labor. This animation shows a pregnant woman ready for birth with her full-term baby positioned head down. Your baby lives inside of your uterus. This is a strong balloon-shaped muscle that contracts during labor. The bottom part of your uterus is called the cervix. A mucus plug fills the cervix to protect your baby from the outside environment. Your cervix opens into the vagina or birth canal. It's through this passageway that your baby enters the world. The placenta is an organ that forms early after conception and grows into the wall of the uterus. It makes pregnancy hormones, delivers oxygen and nutrients from you to your baby, and removes waste from your baby's blood. The umbilical cord allows your baby's blood to travel to and from the placenta. Growing out from the placenta is the bag of waters, or amniotic sac. The amniotic fluid inside the sac cushions your baby in a comfortable, warm environment.
My belly lately has been itchy. The closer that we get to the end of the pregnancy, it's more uncomfortable for sure. I haven't been sleeping as well because he's bigger and I'm bigger, and just like moving a lot, it's harder.
Your discomforts might increase as the baby grows and your body prepares for labor. Backaches, leg cramps, swelling, and an itchy abdomen are all very common. Your growing baby is putting added pressure on your stomach. You may find that eating frequent, smaller snacks instead of large meals is more comfortable and reduces heartburn. You may also feel short of breath. Talk to your healthcare provider if your discomforts are more than you can manage. Remember how fatigued you felt in your 1st trimester? Some women notice that it returns during the 3rd trimester. Tyson, can I have some water, please? Setting aside time to rest is important during these final weeks of pregnancy. It might be hard to sleep during your last trimester, so do some relaxation exercises before bed and try to get comfortable using pillows between your legs and under your belly. Most pregnancies are problem-free, but your healthcare provider will go over important warning signs with you. Look out for signs of preterm labor, which is labor that starts before 37 weeks of pregnancy. A baby born very early may have serious health issues. Call your healthcare provider immediately if you feel your baby moving less, you're leaking fluid, have vaginal bleeding, or if you have more than 4 contractions in 1 hour before the end of 37 weeks. While not all preterm births can be avoided, healthcare providers can do a lot to delay an early delivery. The longer your baby grows inside you, the less likely he or she is to have health problems after birth. You can help prevent preterm labor by going to all of your prenatal appointments and talking to your healthcare provider about anything that doesn't feel right.
I ask a lot of questions at my appointments, and I also call all the time when I have questions. It's hard to know what's normal and what's not. So they've been very helpful.
So we will see you back in a week.
Sounds good. Okay, thank you so much.
Okay.
Preterm labor can be triggered by an infection. Just by washing your hands often and avoiding sick people, you can reduce your chances of getting sick. Good dental care can also help prevent infections that start in the mouth and gums. Finally, try to reduce stress in your life. Limit long hours on your feet surround yourself with supportive friends and family, and get help if you're in an unhealthy relationship.
Your body speaks to you, and you can only do what you can do. And so I don't try to take on all the chores in one day.
She's being more aware of what she's doing and how much energy she's putting into it. So I think she's doing a pretty good job of managing her energy and her time late in the pregnancy.
Things that can harm your unborn baby, like smoking, drinking alcohol, and using drugs, can also lead to preterm labor and cause problems for the baby. Recent studies also show that marijuana use during pregnancy may negatively affect brain development in babies. Enjoy your third trimester. It's an amazing time to reflect on your own life as you prepare to become a parent.
Thank you. Let's move over here. Actually, let me.
This is like kind of unrelated, but still related. Like I know she mentioned, sorry. Hello.
Yeah, go ahead. Yeah.
Like I know she mentioned that like preterm labor can be triggered by infection. And this is kind of like from something I learned previously, like not even from the doctor, just like I know someone that's had it. Would like does strep B like count as something? This is something like no one tells you about, but like strep B, is that like a common thing like that can negatively affect babies? I know like a lot of women of color tend to have it too. So
Yeah, so I think you're thinking of group B strep, right?
Yeah.
Yeah, so that's something that every pregnant person is tested for in the United States in their final trimester, usually towards the end, around like 34, 35 weeks or so.
Okay.
And group B strep is a bacteria that's, generally in about 25% of the population of women at any given time. It is definitely related to stress or towards maybe if you've been having a hard, like not eating well for a while, like those kind of things can bring it up, or if you've had a recent infection and you've needed to have antibiotics. Those are times when we find that you're more likely to have group B strep.
Okay.
And if you test positive for group B strep, then your doctors will want you to have antibiotics during labor.
And is that okay?
So the antibiotics during labor are known to sometimes disrupt the labor pattern, is the kind of one of the big deals, right, Samsarah? Do you have more?
I'm just going to ask permission to jump in if it's okay.
I can see your face.
Group B strep, that's real quick. Other countries don't even test for group B strep.
Exactly.
Group B strep can be in anybody's body at any given time. Especially if you have a couple of days or a few days or whatever, where you got really stressed out, not sleeping well, eating a lot of sugar. You could feel those days where you kind of feel like you kind of have a cold, but then you don't have a cold. That could have been because you had group B strep in your body at that time. The problem with group B strep in pregnancy in this country is that they act like it's a killer thing. The actual incidence of your child actually dying if they catch it is incredibly tiny, and I would refer you to evidence-based birth information on that because they break it all down really well. The problem that I'm concerned about as a doula is that any infection, including group B strep, can weaken the amniotic sac. So then you'll end up with a baby that's born before it's really ready to be born because the bag is weak, because the infection is eating it literally and making it weak, and then you have broken waters. And then you're at risk for induction. If you get the antibiotics in the hospital, the problem with that is that it screws up the mama's inner biome and makes your baby more prone to thrush, thank you. And and it can definitely slow down the labor, impede the labor progress. And you need to have several doses of antibiotics throughout your pregnancy before they feel that you are quote unquote safe.
Okay.
Yeah.
Thank you.
Yeah, that's a good question. And those are important things that we need to know, like as doulas, to remind our clients, hey, this is coming up. This test is coming up. And, you know, it's a good time to make sure you're getting your 8 hours or more of sleep a night, that you're drinking lots of, staying very hydrated, that you're eating your 5-finger diet, which we'll talk about shortly, things like that. So real quick, we're going to go over a few things, some fun, some not so fun, and then we'll get into 5-finger eating, because that's really, I think, the great, really wonderful information there. So just a quick fetal fun fact that in the final trimester, actually final trimester, this is a baby of 37 weeks, a fetus, that your baby can see light through your stretched out skin. And your baby can probably tell the difference between night and day because of that. Something you can do, which is kind of fun, is if you're in a dark room and you take a flashlight to your belly, your baby can find that light, and sometimes like kick towards the light, or you'll see different movement happening based on that light. So it's a fun way to connect with your baby.
Fun.
Yeah, in those final weeks. Something that wasn't mentioned in the video is preeclampsia. And this is something that's really important to, pay attention to. It's a very serious medical condition, and that is high blood pressure in pregnancy and presence of protein in the urine. Some of those warning signs for preeclampsia are severe headaches that don't get better with like medication, vision changes, rapid weight gain, kind of like sudden swelling, especially in like the face, hands, feet, puffiness around the eyes, and pain in your upper abdomen. This is a time when if you do genuinely have preeclampsia, and the first thing to do is make sure that they're doing a test to check that you do have preeclampsia, that you will probably need to be admitted to the hospital for an induction. The video did talk about some of these times when you'd want to call your health care provider in your final trimester. Definitely vaginal bleeding, which is different from bloody show, right? Your bloody show is when you lose your mucus plug, and there is some blood with that, but this is like, heavy bleeding. Fever over 100.4, pain or burning with urination, because we want to like get any kind of infection under control, including a UTI, because that could lead to preterm birth. Problems with your vision or headaches, vomiting or diarrhea that lasts more than 24 hours, major changes in baby's movement, sudden pain in your abdomen, and also trust your instincts. It's super important. If you feel like something is wrong, call your healthcare provider, call your doula. Check in with your people.
May I add a couple of things about preeclampsia right quick?
Yes.
Okay, thank you. I should have said it when it was in front of our faces, but doctors have a way of presenting preeclampsia as this magical thing that just happens, and they don't know why. It could just happen to anybody. And that's maybe kind of sort of true in a very distanced way. Anything can happen. You can do everything perfectly in your pregnancy, and sometimes something can happen. But the odds are that if you are eating well, we'll talk about nutrition in a little bit. If you're eating well, if you're rested, if you have been able to keep your stress down, and your protein levels are nice and high, there is good information about making sure that pregnant people take in 100 grams a day of protein or more. 100 grams is just the minimum. that folks who are rolling that way in their pregnancies are far less likely to be bothered by preeclampsia. Right? So if you've been doing super, super well all of your pregnancy, eating well, exercising, resting, of course, there's some, social problems that impact women being able to have these things. So that's one of the reasons why preeclampsia seems to be more common in low-income women and Black women and Indigenous women, not because low-income women, Black women, and Indigenous women have a magical gene for preeclampsia, but because their lives are visited by massive stresses that make it very hard to be in that Zen space that pregnancy requires. So if you are a woman of color, if you are a low-income person, you can only do the very best you can within your circumstances to get your needs met around food and safety and inner calm. Good meditation practice is helpful. And it would be great if we as a society would actually take care of our pregnant people. There'd be almost no preeclampsia, I would bet, if we did that.
Yeah. And it's important to know also, like, in addition to, of course, to everything that Samsarah just said, that if you have 2 high blood pressure readings in a prenatal appointment, like 2 in a row in your 3rd trimester, that they could label that as preeclampsia or as high pregnancy-induced high blood pressure, and push that as an excuse for induction.
That's another very important point. It's real important to be calm and well-fed when you go in for your prenatals.
Exactly.
And if you just had a car accident before you were showing up at your prenatal appointment, maybe you don't want a high blood pressure. You don't want your blood pressure taken that day. You want to come back, reschedule, not even just reschedule.
Yeah.
Come in when you're nice and calm and you're well hydrated and well fed to get good readings. To actually, if you're really sick, you're really sick. Doing all those things is not going to make your blood pressure go down, right? But if you're well, but you just had a fight with your partner, right? Or you just got an eviction notice, that's not the time to go and get your blood pressure taken. It's going to read high, and they're going to hold that against your pregnancy.
Yeah. And even going and rushing in late,
Yeah.
So, and if they take it at the beginning and it's high, you can ask them to take it again. And after you've had time to relax and calm down. These are the little pieces of advocacy that can be the difference between your doctors pushing for an induction or not. Too. Yeah. Thank you for everything you shared, Samsarah.
Very welcome.
May I add something?
Yeah.
Because, just looking at as a lens from a doula, because of COVID as well, I think something that I know we have been keeping in mind with our clients, and we've talked about a few times in Circle, is especially because people are having fewer in-person appointments, if they have the means or have access to have an at-home blood pressure kit, even for non-pregnant people, but particularly for women of color who are going to get grouped into that high-risk category, independent of a lot of other factors, it can be a really great tool to have your blood pressure data at home, so that if you're missing appointments or if you're getting feedback on your history that doesn't reflect what you see in your own health, you have that as an advocacy tool, especially right now with limited appointments. That's something that we've talked about for people who want to kind of take that into their own hands.
Absolutely.
Very good point. Very good point.
Mm-hmm. So here's some other signs of preterm labor. Change or so this is before 37 weeks, right? We're looking at. So change or increase in vaginal discharge, pelvic or lower abdominal pressure, constant low dull backaches, mild belly cramps, water breaks in a trickle or a gush, and more than 4 contractions in an hour. So for reducing your risk of preterm labor, of course, go to all your appointments. Right now, of course, a lot of those are online. Definitely have those tools available to you. I highly recommend having the blood pressure cuff, things like that for sure. Preventing infections and reducing stress, which is sometimes easier said than done, you know. But one of those pieces that is really, you know, the thing also in pregnancy is that there is a lot that we can't control, like systemic racism and how that impacts our blood pressure and how it impacts our pregnancy, for example, right? Maybe we are one of those people that does all the right things and something comes up. But so the things that we can control are what we put in our mouth, for one, and what we do with our body. Like, are we exercising and using movement? So I do want to talk about food a little bit. Because this is something, sorry about that, that a lot, that you very rarely hear medical professionals talking about. And it is, as Samsarah laid out, something that you can do that can have huge impacts on your health and the health of your pregnancy. Remember that you're like, in pregnancy, you're building eyeballs and brains and tissue and bones, and your blood volume's doubling, and you're creating an entire new organ, the placenta. Like, that's a lot of work for one human body to do. And so you really need to have some additional nutrients on board to sustain that. And a lot of so some people, they kind of can hobble through that pregnancy without additional food and whatnot, but you're likely to be a lot more exhausted. You could be more susceptible to infection, to stress, things like that. So 5-finger eating is really like a mnemonic that we use to remember how to get all your macro and micronutrients in as a pregnant person. And it was developed by a midwife named Valerie Alhalta, and it's based on your 5 fingers and your palm. And the idea is that you'll be getting these 5 things that we're talking about at each meal if you eat, 3 meals in a 3 meal a day kind of diet. You can also, some people, especially at the end of pregnancy, break that up into more like 5 meals a day or include snacks. All of that is wonderful. Also, with 5-finger eating, the palm of your hand is about the size of a serving. So the first thing on this list is protein. Protein helps build your baby's body, your placenta, umbilical cord, amniotic sac, like all of that needs protein to build. And so it's super important. And we now actually have data. The first study to even confirm this was done in 2015, that a pregnant person needs 100 grams of protein a day.
2015.
2015.
So the midwives have been telling their clients to eat like this since Jesus. I just need to say, I just have to put that out.
And then exactly. And then things like eggs and liver are the only 2 foods that contain enough significant amounts of choline. Choline is essential for the brain development of fetuses. So there have also been studies that shown that people who've had, I think it's about 3 eggs a day, maybe, who've had significant, and most people will lean more towards eating the eggs and liver, but whichever one you like, go for it.
That's one good omelet,
Right. They've noticed there's been differences in babies' brain in development postpartum, but we can't actually see that. So protein is hugely important, and protein, at least 3 times a day. Green leafy vegetables are next, and green leafy vegetables first are important because you need that fiber from the green leafy vegetable to help digest the protein. Otherwise, that protein kind of just sits and has a hard time digesting in your system. And protein is also full of all kinds of micronutrients that you need to sustain a healthy pregnancy, and especially when you think about your blood volume doubling and that iron that you need on board. But green leafy vegetables also have calcium, magnesium, potassium, zinc, a whole host of vitamins, especially vitamin K, which is very important for clotting factor. When your baby is born, babies are not born with significant clotting factor. They don't develop in that until they're about 8 days old. And so if you get significant amounts of vitamin K while you're pregnant and postpartum and nursing your baby can get that vitamin K through breast milk.
And there they are.
Lovely greens.
Wait, I'm sorry. Do you want the clotting factors or not? Like, I know sometimes they're good for stuff.
You want
Okay.
What did you say, Samsarah?
I said, yes, you want the baby to have clotting factor.
Mm-hmm. Yeah. Yes, this is a time when you do. Whole grains are next. Whole grains give you energy, and because we absorb them slowly, they help us they sustain us to keep going. They also have important enzymes, another source of iron, fiber, vitamin E, B complex. B complex is also important for like nausea and morning sickness. It's very helpful for that. And you want like, when you think of like whole grains and like a whole wheat bread, you don't want that like whole wheat bread that's like light brown bread. That's like, you want something that's like, you know, hearty and heavy and really whole grains. But brown rice, quinoa, millet, there's so many wonderful whole grains that you can eat. Next, you want a food source that contains vitamin C. Vitamin C is really important for your immune system. And we're talking about like that preterm labor and when you want to avoid infections, to avoid preterm labor, that vitamin C is really important for that. Pregnancy is a time.
Vitamin C also strengthens the amniotic sac as well.
Yes, it makes the amniotic sac more elastic so that it can withstand the kicks and movement of a baby. Right. What was I going to say?
Sorry.
Can't remember. No, it's fine. I'll come back to it. You know, fruits are a wonderful source of vitamin C. But if you let's say you squeeze some lemon juice on your spinach, that it actually increases the amount of iron you can absorb from that spinach. So vitamin C, along with leafy greens, helps you increase the amount of iron you can get from those leafy greens. That is super helpful too. And number 5 is water. This is, you know, think about the amniotic fluid. Think about your blood volume doubling. Water is super important for replenishing the environment that your baby is growing in. It also helps you regulate your body temperature. It helps lubricate and cushion your joints. And it helps you, you know, getting rid of waste in your body through urination and preparation and bowel movements and all of that. So, you know, pregnant women ideally should have about 10 cups of water a day. One way you can, you know, check that is make sure you're drinking to thirst because you are thirsty. And your pee should be the color of like a light lemon juice. If it's very dark in color, then you're likely needing to up your water intake. And if you don't like the taste of water, like certainly like squeezing some lemon juice in it, people put just like a little bit of like fruit in it, can definitely help some people, and that's another way of getting your vitamin C in. And then last, so we have our 5 items, and then last we have a thumbs up for fats. Good fats get a bad rap, but they are really important for your health and your baby's health and development. Fat removes dead cells. It helps manage your mood and your brain function. Cholesterol is actually really important for brain development of your baby and for your own brain function energy. You know, most of our like whole protein foods come with some kind of fat source. If you think about eggs and the yolk, you think about chicken and the skin on the chicken or the fat in a chicken. Same with, you know, beef and all of that. Avocados are a great source of fats, and as are, you know, nut butters and things like that. So that is wonderful. And when you're cooking with fat, use fats like olive oil, coconut oil, butter. There is actually, I was listening to a podcast recently about concerns around canola oil, in particular impacting the function of the placenta. So
what is
impacting the function of the placenta.
Oh, real. Canola is a horrible oil anyway.
Mm-hmm.
It's a horrible. There is a strange background noise.
I'm hearing that too. Everyone. Oh.
So if everybody except Mika and me could have their mic off, and then if you want to speak, definitely turn your mic back on, but that might cure it. It might be a sound you don't know you're even making.
Yeah.
Happens.
It's gone away maybe now.
Okay, that's good.
So are there any questions about nutrition and pregnancy at this point? Okay. Students, this is what we teach our clients. We teach them 5-finger eating. So it's really important to know this and to take notes about this.
It is the most important thing that we do to make sure that mamas have this information. Because mamas are being sabotaged every day. They're showing up for their prenatal appointments and they think they're doing what they need to do, but they can go through all their prenatal appointments and never have a really serious talk about nutrition with their healthcare provider unless they're seeing a home birth midwife.
Absolutely. Absolutely. You know, in kind of a standard hospital or OB experience, you're going to be told that you can only gain a certain amount of weight. And that's it. You know, that's not a conversation about nutrition, but that's kind of like where they file it under.
Yeah.
That means nothing, really.
If you're eating 5 fingers, you will gain what you need to gain for the pregnancy. You have to gain weight in pregnancy, but you will be gaining the weight of the child, the amniotic fluid, the placenta, the doubled blood volume. Okay, if you're sitting around just eating Cheetos, then all those carbohydrates just get stored as fat. But the protein mixed with all the other things, it goes to work to keep the pregnant person alive, to keep the baby alive, to keep all the organs functioning well, so that you can have a pregnancy. We accept in this culture that pregnancy is a time when it's okay to feel like crap. We, Schiffer Circles doulas, don't accept that.
Yeah. Absolutely.
Be vibrant and happy and full of, you know, joy. I mean, you're bringing a new life into the world. And the food is the fuel for that.
Mm-hmm. Absolutely. Thank you.
Mika, can you go back to the thumbs up for fat slide? I'm sorry,
Yeah.
I was writing down the examples of the good fats. Thank you.
We can send this PowerPoint slides to you later as well.
Thank you.
All right. Does that work, Zaria, if we send it to you later? Cool. All right. I got to be mindful of this time here.
Yeah.
All right. So let's talk about labor. So it's interesting. These slides start with labor pain. And I think it's interesting that it starts here. And I will say that one of the biggest, kind of the biggest questions or the biggest concerns or the biggest areas of anxiety or concern for a pregnant person is like, they think about being pregnant. When they think about their labor, there's like this wall that comes up around pain, right? And first, thanks to Samsarah for kind of reframing this for me. First, what we're experiencing, we don't really have a word for exactly in the English language, right? When you break your arm, that's painful. That hurts. And that's important because that tells you need to go do something about this now, right? There's a problem here. And so when we're in labor and we're feeling the intensity of the contractions, remember the uterus, a 9-month pregnant uterus is the strongest muscle in any human body. And when it contracts, it's a powerful feeling. And so we translate that as pain. Right? We tell ourselves that's pain, but it's not the pain of breaking your arm, right? It is an intensity of a physiological process of something that has to happen so that your baby can be in your arms.
And it's very different for different women, you know, and it depends on what position the baby is in mama's body, what's going on with the labor and things like that. I had big fat baby boys. I can't say the experience was painful at all. You know, I know that folks who are having posterior babies, when they say it hurts, they're not lying, right? And there's reasons for that range of experience and things that can be done to bring it closer to being just this amazing trip that your body took, that you went along, that you cooperated on this amazing ride rather than painful.
Absolutely. Absolutely. Yes. So here, labor pain is described as, they use it as an acronym for purposeful, anticipated, like it's going to come, it's going to happen. A reminder that it's intermittent. There's downtime. You get a break between contractions. And also it's a nice reminder that your body is working up towards those contractions. So for most people, they don't start off with the most intense contractions that is in transition in the final stages of dilation. Your body's working its way up into that. And that is normal. It's not an illness. It's not an injury. But what can happen sometimes, especially if you don't have a doula or someone experienced, is that it's easy to get in this fear, tension, pain cycle. So you're afraid of the contraction that's coming. You tense up. The contraction's over. You don't really relax after that. And then the next contraction comes and you get even more tense. And then that creates pain because you're creating this tension in your muscles, and that can be painful. And so a lot of another
nice thing that this slide reminds us is that this cycle also affects the baby.
Absolutely.
So the baby has to cooperate to get itself born. There's little things that the newborn does to help itself, to help its mother out. And if the baby's afraid and shuts down, it's a live little creature in there. Imagine a little bunny or the little soft baby creature, right? And if it gets frightened, what the little baby mammals do, they shut down, and then they can't participate in their birth.
And same with our cervix. Our cervix will not fully dilate if it is frayed and if there's tension. You need your cervix needs to be able to open. So yes, that's really important. It's one reason why hospitals offer all kinds of medication. Oh, she just needs to relax. She just needs to calm down. But there's so many ways of doing that. There's so many ways of doing that. And it's not just an IV medication or an epidural that can help you relax. And there are other ways of doing it that's better for you, that is optimal.
Have side effects. There's no side effects to meditation and prayer. And a nice warm bath. Or your back getting rubbed. There's no minus to that.
And even I was reading on evidence-based birth, I think with IV pain medications, the satisfaction level of women who use fentanyl and women who use non-medication versions of coping measures, their satisfaction was like the same or greater and they rated their pain level the same.
There are studies about doula support that say the same thing, that people who have had doulas and people who don't have doulas, the satisfaction level of having a doula in the room is the same. So it might as well. I think it was Dr. Claus who said if a doula was a drug, it would be inhumane not to use it.
Yeah, totally.
Woohoo! Labor is near.
Labor is near. Another one of the biggest questions, I guess, I feel like I get is like, well, how do I know when labor is going to start, right? Like, it's a loaded question. There's so many ways. But you might start feeling more warm-up contractions happening. Warm-up contractions tend to happen up a little higher. Sometimes it's your entire uterus tightening. Sometimes it's little parts tightening, but they're not strong enough for you to cause actual dilation. You usually also feel them in front. Lightening, or like the baby lowering, releasing of the mucus plug. So that's a plug that's inside of the cervix that when your cervix starts to soften a little, and maybe sometimes even dilates just a little, the mucus plug will come out. Nesting. Sometimes people just lose a tiny little bit of weight right before labor. Backaches and diarrhea. Your body's kind of clearing its system out sometimes right before labor starts.
Say a little bit about nesting, because nesting can be quite a dramatic thing.
Yeah.
For some women or soon to be birthing people, they feel the intense urge. It's like, you've got to get your nest ready. And for human folks, it's very funny what that can look like. It could be like one of my dearest girlfriends who just woke up when she was, almost 40 weeks and decided that she hated the color of her house and it must be painted immediately, and got all her friends together to repaint her house. And after the house was repainted, she went into labor. It can be dramatic, but less dramatic. It's like you're making sure that you have all the supplies for the baby, a lot of anxiety, feeling that you're not ready to have the baby. Folks around you have to be very cooperative and loving and sensitive and help you reasonably prepare your nest for your little chicken.
Yep. I remember the day, maybe the day before I went into labor with my second child. And I was at like 40 weeks and 5 days. And I was like, I'm going to be pregnant forever. All kinds of feelings like that. Like, rationally I knew this was not the case, but of course I felt that way. And I was talking to my midwives, and I was like, and kind of getting to the heart of what was holding me back. And I was like, I feel like my living room, I cannot have a baby in this living room. Like, this is not set up right? I did not like where the coffee table was. Not okay. So then the midwife got me to go lie down in the bed, and my wife and my mom and my mother-in-law rearranged the living room to my specifications, and I went into labor next day.
There you go. That's what that looks like.
Yes.
That's what that looks like. Beautiful.
There were so many tears on my part involved with that.
Sure. And people have to be very kind.
Yes.
Not the time to try to be logical with an emotional person. I actually feel it's abusive being logical with someone who's emotional. Be helpful, be kind, be sweet, and see if there is a logical way to work out the emotional problem. There usually is. She just wants the furniture moved. Move the furniture. What's the biggie?
No, exactly. So we're still kind of, no one knows exactly why labor starts, but there is theories and research being done suggesting that there's a shift in hormone and that the babies release a hormone from their lungs that triggers the onset of labor, which makes a lot of sense because the lungs are one of the last things to develop, or the last kind of organ to develop in the baby, along with putting on weight. And so it would make sense that that would, when the lungs are fully developed, that labor would then start. It's certainly one of the bigger concerns around preterm labor.
And early induction as well. So if everything's okay with your pregnancy, but you're being pressured to be induced for some reason, and you've been having everything perfectly healthy, it's important to know that one of the big triggers is the development of the baby's lungs. And so to wait until your labor starts on its own has profound benefit for your little one.
And especially during this time with COVID-19.
Exactly. We want people with strong lungs on the planet. We need strong lungs on the planet.
Mm-hmm. Yep. So, true versus warm-up. It's interesting language. So labor contractions versus warm-up contractions.
Yeah, they're all true.
Exactly, right?
Different things. So it's like I'm fine with warm-up contractions. That's great. Yeah. And then I would say like labor contractions.
Right? Yeah, that's what I would say.
Braxton Hicks as opposed and labor contractions in Braxton Hicks, I can see. Yeah.
Right. So a lot of people describe labor contractions as kind of starting in the back and wrapping around towards the front. I know that's certainly how I felt them. They eventually grow closer and develop a pattern. That's really how you know. So you give it time and see what it does. Warm-up contractions don't have any kind of regular pattern. They don't usually cause any back pressure. They ease up over time. And they definitely lose intensity. Sometimes they're tightening portions. Sometimes you just kind of feel just a tightening all over. All of that is true. So in the weeks leading up to labor, one of the things that is oftentimes happening or kind of needs to happen before you start dilating is your cervix needs to efface. So that means it needs to thin and soften. And here there's a picture of cervix that is not effaced. So the cervix starts out kind of thick, and hard, firm, I should say. It feels kind of like the tip of your nose, and it's closed. And then the closer you get to labor, and then even in labor, your cervix is softening and effacing. So that means it's thinning out. So you can see this is a cervix that is 100% effaced. And doctors will talk about this in percentages. And so in order to fully dilate to 10 centimeters, you need to be 100% effaced. Now, in labor, you'll efface and then dilate a little bit and efface. And a lot of times why early labor is so long, especially for first-time moms, is that effacement piece. And so sometimes what I hear is like somebody's in labor, they've been in labor for like 12 hours, they go to the hospital, they get checked, and they're like, I'm 2 centimeters and I am devastated. But really a lot is actually happening because that effacement has to happen. Your body is doing the work that it needs to do to birth your baby. We're just not reading it in centimeters in dilation right now. you know, but know that that is like really important work that's happening.
And
You have to face.
It's really specific for the first time birthing person.
Yeah.
Your other babies will come a lot quicker.
Yep.
Once your body gets that effacement piece down and you get to have your first beautiful vaginal birth, then the body has the information on how to do that. The brain has the neural net information on how to do that. And generally speaking, second babies come a lot quicker because of that.
Yep. Absolutely. So when you are in labor and when you're, you know, wondering with maybe these contractions, thinking maybe these contractions are actually labor contractions, and you might decide to start timing them. There are many, there are a lot of apps that you can use to time contractions nowadays, which is fine. But what you're looking for is the duration of the contraction and the frequency, how often they're happening. So you would start your clock, note that time of when your contraction started, note the time when that contraction ended, and then you would note the time that the next contraction started. And that lapse in time is the frequency. So here we have the contraction, which is this contraction is a minute long. And they're starting, actually the frequency is the start of the contraction to the start of the next contraction. So 3 minutes. Yeah. So many hospitals have, actually, I think that's the next slide we can go to. I'm just going to mention it now. Many hospitals have a time when they want people to come in, and they call that like the 5-1-1 pattern. And that's when contractions are 5 minutes apart, 1 minute long, for an hour. And not like, oh, there's 5 minutes and then 7 minutes and 6 minutes and, you know, all of that, and 45 seconds and 1 minute for an hour. No, you want to see that they have this regular pattern going. Now, if you live very close to your hospital, and especially if you have a doula, you can wait until those contractions are a little bit closer, like 4 minutes apart or 3 minutes apart. UCSF is even recommending that all clients come in at 3 minutes apart. So the reason why you would wait a little bit longer, because even at 5 minutes apart, it's still probably a little like close to the end of early labor-ish, and things could slow down again. You know,
very well slow down.
Yeah, and you want to go to the hospital when nothing is going to slow down your contractions. You can see $100 bill on the ground as you're walking up to the hospital, and you're not picking that up because you're in labor. You know, that's when you want to go in. You want that kind of intensity. And when you go in, and one of the benefits of waiting to go in for that is that you will avoid unnecessary interventions. There's really not anything that the hospital can offer you in early labor. And our Bay Area hospitals, if you are under 4 centimeters dilated, they'll likely just send you home. So you've gone to the hospital, now you have to go home, and psychologically and emotionally can be really disorienting.
Another good reason to have a doula, because basically what we're trying to do with folks who are planning, who are healthy birthing people and who are planning a natural birth, meaning a birth without medical interventions, is that you will end up doing the majority of your labor at home. If you're hanging out at home and getting support from a doula, even right now, our doulas will be with their clients in early labor at home, whether they can go into the hospital or not. But you'll have your doulas with you at home during that early time. You can stay home until it's 311. The doula can help you to keep an eye and make sure there's no signs of any concern, which most healthy mommies will not have. And then you go into your labor at 311, you're very much more likely to be checked out to be 5, 6, 7 or more centimeters dilated when you enter the hospital. And it's important to know that you're going into the hospital at the peak of your labor. So your need for support will be really high. Your partner and support person, whoever can go into the hospital with you, and Doulas would already know this, is to really stay close to you and give you lots of loving support while they ask you crazy left brain questions that you don't want to answer because you're too busy being in labor. Having your partner ready to tell them what your social security number is and tell them the last time you peed and answer all those annoying questions so you don't just kind of melt down and start crying for an epidural, which is something that can happen because you're trying to stay in this beautiful dream space and you're being pulled into linear space and it hurts and it makes your body hurt. You get tense, right? So it's important to remember that you're going into the hospital at the home stretch. You have just a few more hours usually, and that you can do it. Just rely on your support people to get you through, your partner and your doula.
Mm-hmm. Absolutely. And something that's not mentioned here is the role that oxytocin plays, which is really important. And I've learned so much from Jessalyn about too.
Our oxytocin goddess.
Our oxytocin goddess, who will have a workshop on that coming up.
Coming up. Yep. Very soon.
It's really important to understand that oxytocin is the hormone that makes your uterus contract. It's oxytocin. And oxytocin is also the hormone of love, of connection, of that feeling of safety and security, all of that. And where is that place that you feel that love and connection? It's probably at your home if you have a safe, loving home. And so when your labor is starting and it's just, your contractions aren't that strong and you kind of need to like rev up, right? One of the best things you can do is being in an environment that is optimal for oxytocin to flow. So when you're at home in early labor, you're in that optimal place for oxytocin, and it's wonderful you can just stay at home. But if you're planning on going into the hospital, if you can be at home so that your levels can rise optimally, then again, that's another way where you are more likely to avoid some of those interventions from the hospital because you're in that space that's perfect for your love hormones to just flow. And because what happens sometimes too is that people go in too early is that because there's all this left brain stuff going on, labor can peter out too, because you're not in a space for that oxytocin to flow, right?
Yeah, or if someone says something sharp to you, or if you get a nurse who's not being very professional that day and she's snapping at you, that could shut everything off.
Yep.
So have no fear, get loved up again, get rid of that nurse. You get to ask for a nicer nurse, and the hormones will come back. Some kisses from your partner or your mama or your auntie, whoever's there who loves you, and get things going again.
Absolutely, yes. So many people actually do still ask me like, are surprised when they find out that labor doesn't start when the bag of waters breaks for everyone. Actually, it's only 10% of labor start this way. And in those cases, the water might be a trickle or a gush. And you do want to pay attention to kind of the color, the smell, the amount and time. So amniotic fluid should smell kind of like the ocean. It's a nice smell. It should be clear. And a trickle or a gush is fine, either way. Now, doctors, so hospitals, there's this interesting thing where hospitals tend to want your baby born within 24 hours of the bag of waters breaking. But for many people, if the bag of waters breaks, if that's the first sign of labor for you, you'll go into labor sometime within 24 hours. And so you have this big difference between what the hospital wants and was kind of the physiological norm. Of course, their concern is infection. So how do you get infections? Well, internal exams is a big way where how people get infections. And where does that happen? In the hospital, right? Certainly anything going up inside of your vagina at that point. And how do they check for infections? They check your temperature. And that's what they use to determine whether or not they want to move forward with, let's say, antibiotics, so they're concerned about an infection. So if you have a thermometer at home, you can certainly monitor your temperature too as well there.
If you're blessed to be having a home birth, you'll see that the midwife is not as concerned about this. She will be doing, as Mika said, like checking you, making sure there's no signs of infection. She also, your midwife tends to know your whole pregnancy history. Your home birth midwife has been dealing with just you and knows you personally. So this person knows what's normal for you and will know if there's a deviation from your personal norm, and will take appropriate steps with herbs or whatever she's got in her amazing midwifery bag to help support you. If you're having a hospital birth, they're not going to let you get in the tub, and no getting into the tub, but showers are okay. At your home birth, you probably have your birth tub or your home bathtub, and you would be 9 times out of 10, a home birth midwife is going to say it's not a problem for you to take a bath. If you want to do homework on your own, there's a lot of information about why midwives have a different opinion around this than doctors. I'm sure evidence-based birth has some stuff on it, but it's also important to remember that the body is always making more water, and that water is flowing downward and out. So if there was some bacteria that decided to go live in the beginning of the vagina or the mouth of the cervix, the water is constantly flowing down and washing out. The system is always cleaning itself out.
Yep. And
there have definitely been studies done in Europe, of course, that say that's why they're not concerned in Europe like American MDs are concerned here.
The one thing that might be a good idea to do is also to take some vitamin C, right?
It's very helpful. We as doulas can't recommend things, but it makes perfect sense. We definitely can point out something that makes good sense. You want to keep your immune system strong. And it's also a good idea, so we did talk about during nutrition, having foods with vitamin C, because vitamin C keeps the bag strong and elastic, as you mentioned before. So yeah, you could prevent, we're about preventing issues for our clients.
Yeah, exactly.
Like we would want to have the bag of water break when the mom is pushing. When the pregnant person is pushing and that water bag breaks, you get this big burst of hormones that help you have an unbearable urge to keep pushing your kid out. It's crazy helpful. And some little kiddos can get born in the bag. Right? Some wiser cultures than ours used to know when their shaman came because they were born in the bag. So, you know, we wanna let go of the cinematic vision of everybody's labor breaking with the labor is started by the water bag breaking. That actually, as you said, is very few births, so we would like it to be even fewer.
So in a traditional OBGYN model, we break up the stages of labor. Traditionally, it's 3 stages, and kind of added recently, a 4th stage has been added, which is recovery and breastfeeding. And so we'll spend a little time going over each one of these stages. So the first stage is early labor, and contractions during that time can be anywhere from 5 to 30 minutes apart. The strength, they're usually about, 30 to 45 seconds, and they might feel like strong period cramps or something along those lines. That's often what I hear people say. Maybe not even strong period cramps, Early labor is defined as kind of like 0 to 6 centimeters. And oftentimes in early labor, people are feeling really happy and excited and maybe a little anxious. The one thing that is I think important to caution people against is using up all their energy in the beginning.
Yes, like this cute couple in the picture.
Like this cute couple.
You doing that stuff. Early labor is for resting. You want to stay in the house. You want to rest. You want to eat. You want to hydrate. You want to make love, enjoy. But all that walking around, and then you have to push 24 hours from then. Not a good look, right? You'll be tired.
Yeah.
Labor is very active. It's very hard to rest. So just be happy, be excited, be snuggly, make oxytocin, eat, drink, and stay home. Rest.
I often, will hear people say, well, I'm just going to send out this one last email, or I'm just going to do this one last load of laundry or dishes, because they have energy there, right? So I'm going to just do this, and then I'm going to go to sleep, and then tomorrow I'll have the energy for labor. And you know what happens? They wake up like an hour later and like labor's on and they can't sleep now. And they've had this whole day of using all this energy, and then they get to that point and they're exhausted, and labor is kind of just really starting to kick up at that point. So it's important that when you feel those early labor contractions, even though they're not that strong, that you honor that as the beginning of labor and you rest, because it is a marathon. It is an endurance marathon.
You want to pace yourself. Yeah.
You want to pace yourself. Exactly. Mm-hmm. So they talk about the 5-1-1 pattern we mentioned earlier here. If you are like vomiting a lot with contractions early on, the concern is that you could get dehydrated, which could cause kind of a funky pattern of contractions. So there is a concern there. If you feel a lot of like you have to poop, a lot of pressure in your rectum, you might be further along than you expect. And you might be one of those people where it's like, wasn't really that big of a deal. I was just talking to a client not long ago where she said, I thought it wasn't that big of a deal, but they said I should come in because she was GBS positive and her water broke. So I got in there and it wasn't that strong. And when we walked to the hospital, to my room after she was checked in, I had one strong contraction, and then they checked me and I was 10 centimeters. It really wasn't that bad at all. So if you feel a lot of rectal pressure, even if it doesn't hurt, right? Like you could be further along than you thought.
Definitely.
Yeah. So after early labor is active labor. So these stages, so it starts at, early labor is the longest of these stages, right? And then they start to get they get shorter as we go on and you get closer to birth. So then you have active labor, and active labor, this is when contractions are like 3 to 5 minutes apart. Contractions are about a minute long. The intensity is increasing. This is if you are having a birth outside of your home, this is the time to go to the birth center or the hospital, is in active labor. Active labor, it's a great name for it because it's a good time to be active. It's a good time to be moving. This is when you see those cute like YouTube videos of mamas dancing in labor, when you're using kind of upright positions. It's a wonderful time for all of that. And of course, if you are able to rest and still rest, do it, because you still have some work ahead of you. But those are all, good things to do in active labor. And active labor is from about 6 to 8 centimeters. And then the final stage of this first stage of labor is transition. And transition is that dilation from the final dilation that you're doing from 8 to 10 centimeters. And during transition, contractions tend to be really close together. They're like 1 to 3 minutes apart, and they're 60 to 90 minutes long. So this is that increased intensity. This is a time where it's not uncommon to vomit, to have hot flashes, to feel just really kind of like frustrated, irritated, but also feeling really dependent, like your partner needs to be right there and they can't go anywhere at that time, right? Maybe you need to look at your partner in the eye, or you need to squeeze their hand. You need them right there with you. This is also the time that oftentimes even the person who's like the most committed to an unmedicated birth is like, that epidural doesn't sound so bad. I remember thinking that at my home birth, like, I could go in now and get an epidural. Right? And then as doulas, for us, when we hear that, like, oh, this is just, I don't know if I can do this. This is really hard. This is so hard. It's kind of like, we're kind of like, oh, good in some ways, because we're like, that means that we're moving along. We're getting close to the end here. And so that reminder, it's really important for people in labor to have that reminder that when they're getting to that point where it's really intense, that they could be really close to the end. And so some of the things that are helpful at that time, like one of my recommendations always, like when in doubt, like water. Water is the answer. Like get in the shower. If you have a tub, get in the tub. That can just really help relax your muscles, relax that fear, tension that you're feeling. And the thing is, so in labor with each contraction, right, you have oxytocin, which makes you contract. And then after oxytocin, after the contraction's over, your own natural beta endorphins kick in, give you that kind of like high feeling. And as the oxytocin increases through your contractions, so you have more and more on board, you have more beta endorphins on board. So when you get to that point where it's like super intense, if you don't feel like you can go any longer, if you're able to kind of jump over that hurdle, you will be hit with a huge dose of beta endorphins, and you'll just get kind of nice and high. And the goal is to get to that place so you can just ride out till it's time for pushing. It's time when like all of your support people around you need to remind, like be super supportive right there with you, give you your affirmations, allow you to complain as much as you want, and still just be there and loving you and supporting you.
I think that's one of the most important things that doulas can do. Like we're making sure that love stays there, support stays there, excuse me, and we're validating the client's experience. So when my client looks at me and says, you know, I think an epidural would be a really good idea right now. I wonder, you know, I could have an epidural right now. My response is, yes, you could. It's not our job to tell the client no.
Right.
You could. And then just giving that permission, my clients look at me and they remember all the side effects and they remember all the reasons why they didn't want one. And then they're like, no, they won't do it. They don't do it. Right? Now, if you have a professional nurse in the room, she's going to let that happen. The challenge is when you get an unprofessional nurse in the room and she starts talking epidural, 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 because the client has said the word epidural. Right? So one of the things a doula can do very professionally is to remind the nurse, please, she'll ask, you know, the client will ask for the epidural if she wants one. That's on the birth plan. You get to do that reminder. And then again, that could be a moment where the client kind of loses it and then the epidural ends up happening, because that moment of, I don't want to call it a moment of weakness, because I think it's not a moment of weakness. I think it's a perfectly human moment where you are considering the most challenging thing that's happening in your body. And I believe that that's a moment of sabotage, actually. If someone comes and starts egging the person on when when that birthing person is trying to be strong, then that person is a saboteur, right? And so sometimes you can stop that from happening, and sometimes you can't. And at the end of the day, if the client asks for an epidural, then the client gets the epidural in the hospital.
Mm-hmm. Yeah.
Could I add a quick snippet there about the offering the epidurals?
Mm-hmm. Please.
Who's speaking?
This is Christina. Sorry.
Go ahead, Christina.
I'm putting my video on. A snippet about that is that it's so similar to like hawking like street drugs, and the idea that, you know, I've seen nurses really coming at my clients like that, in the sense of like, this is going to make everything better. This is going to solve all your problems, you know, in the same way that folks who, you know, are hustling street drugs say, like, this is going to take you to where you need to be. And the truth is that no drug can do that. And it's so tempting. I mean, it's
So
they're offering you something to solve all your problems, so why wouldn't you take it?
We want to point out that Christina is an RN, so she's speaking from that space, as well as an amazing doula. So that's a wonderful two hats that she's got on, and a very solid point. Thank you for saying that.
Yeah. I remember another nurse explaining to me that in their training, that they're trained that you have to treat pain. That is your training, that you must treat pain. But here's the deal, and I'm going to get back to that pain. Is it pain? Are we defining this at pain, or is it intensity? So it's not the pain of a dysfunction, of something wrong.
This is not a gunshot.
It's not.
This is a normal part of the physiological experience of birthing a human child.
Yep. Exactly.
So, yeah, their training is not flexible around that.
Yeah.
And so of course there's some discomfort, and yeah, that leading, that wanting to. That's the whole thing about medical model. It's like everything is a sickness that must be treated. Pregnancy is a sickness. We must treat it. We can't just sit and watch it happen.
Yeah.
Give her some water, some juice, some honey.
So, the second stage of labor. During the second stage of labor, contractions actually start to slow down again. This is right before pushing, right? But contractions can be longer, 60 to 90 seconds. This can be described, you can have, some people have like a kind of a rest and be thankful stage, right? Experience. And it's birth. I was looking at these two different slides. So contractions during the pushing phase, this second stage of labor, tend to be the longer contractions, those 90-second contractions, but you do have a little space. You typically do have a little bit more space in between them. A lot of people describe the pushing contractions as feeling good, in the sense that you're doing something, right? During kind of the first stage of labor and the 3 stages within that, you are, you're kind of doing all these coping measures to take your mind out of it and let your body do its thing, right? But when it comes time to pushing, like you get to push, right? Like you get to use all that energy, and that can feel pretty good for a lot of people. It is also, there's a lot of, you need to have a good store of energy on hand, which is why that rest in the very beginning is so important, because your labor is like this crescendo, this this crescendo of intensity of hormones. And here at birth, you're at that top of that. And so you want that energy stored up for that time. We're going to talk more about like comfort measures and things you can do at these different stages, but that's what's happening here. And we'll check on timing, but we'll probably have time maybe to watch a little video, which is really sweet, this birth video. Let's see. So right after, okay, actually, let me go back a little bit. Take a step back with hormones, talking about hormones. So transition, you're experiencing some of these you're experiencing the peak hormones, peak oxytocin, peak beta endorphins for that first stage of labor. And then right after your baby's born, you're experiencing those even higher levels of oxytocin. And so when your baby's born and you see your baby for the first time, you could have been minutes before where you were just annoyed with everyone in the room and they needed to, shut up and whatever. And then you see your baby and you're in love with your baby, you're in love with your partner, you're in love with everyone in the room. And it's this huge shift. It's the highest amounts of oxytocin any human can experience are those moments right after an unmedicated birth. And there's good reasons for that, so that you bond with your baby, and also so that your body produces enough oxytocin to clamp down your uterus fast to prevent hemorrhage. So your body is designed to do this. So in the third stage of labor, that's the birth of the placenta. It usually happens like 15 to 20 minutes or so after birth. And you might feel mild contractions, sometimes getting a little upright helps, but because the placenta doesn't have any bones, it's a lot easier to give birth to than a baby. And some people, they're just so in love with their baby that they don't even they're like, oh, I don't really even remember birthing the placenta. But right after you birth the placenta, so inside of your uterus is this kind of big open wound from where your placenta was, and that does need to clamp down fast to prevent hemorrhage. In the hospital setting, it's important to know that they will give you Pitocin without telling you. So you may have had this totally unmedicated birth. You may believe that you had an unmedicated birth, but unless you give specific instructions in your birth plan for them not to give you Pitocin unless it is medically necessary, or unless you ask for it, unless they ask you permission first, they will just give it to you. And even in that case, many times they will give it to you. So as a doula at birth, I'm often myself or my assistant, I have standing near the IV bag, especially if you have an IV, because I've caught many nurses trying to give it even if it was in the birth plan that they did not want it unless medically necessary. Now they're doing that in hospitals. Liability, maybe biggest reason. They can say that they've done everything
Also because of the impersonal care that folks are given, also because they don't teach people about nutrition or monitor that. They don't know how people have been eating. They don't really know the condition of the people that they are treating in labor. And so they want to to prevent liability, they want to be a step ahead of everything. They assume that everybody's eating poorly, everybody's not taking care of themselves, and that they've got to save women from their bodies that are going to explode any minute.
And it's also good to know that, like in a home birth, the home birth midwife is also going to want to make sure certain things are in place to make sure that you have that peak oxytocin level postpartum to help prevent hemorrhage. So that includes like low light and low voices, a warm room, feeling just that feeling of safety. So can you have that in your hospital? I've definitely seen the low lights in the low voices. Like that's a really important thing to add on your birth plan, like during pushing and immediately postpartum, like low voices. Otherwise you might have a nurse being like, push, push, get angry at it, get angry at your baby or whatever. I've heard this, right? So if you're getting angry at your baby, if you're getting angry at your body in that moment that you're pushing, how is that going to impact that peak oxytocin level?
Yeah, it's the opposite of oxytocin.
So those become important things.
Once your baby is born, just being able to smell your baby, just being able to hold your baby, make eye contact you will fall into this little creature's eyes like nothing ever in your life. And that is all those hormones firing off in your body, doing beautiful things to help the both of you stay alive.
Yep, absolutely. And then we have the 4th stage. So also, I think this was popularized by midwives and then kind of co-opted by hospitals of the golden hour.
Yeah.
Which is that immediate hour postpartum, or hours, really, more than one postpartum. There's no rush on it. But we know that that time is really important, that it's important that that you and your baby and your partner all have time to bond, that your baby has time to breastfeed, that you're doing skin to skin. It helps for you physically, it helps with with the involution, with your uterus contracting back down to prevent hemorrhaging. It helps you bond with your baby. It helps your baby's blood sugars and breathing and body temperature, especially that body temperature immediately postpartum, like all of those pieces. Samsarah, you were just talking about that, like survival, right? Of like that immediate postpartum period. And there's no reason to rush a baby off to be bathed, to be weighed, to be measured, to get shots, all of that in the moments right after birth. Not necessary.
Don't let hospital people wash your baby.
No.
Honestly, your baby's not dirty. The baby's just come out of your body. It's full of all the wonderful microbiome stuff that both you and the baby need. You kiss your baby, you ingest that. The baby kisses you and ingests you. And again, these are things that are life-saving things that will turn on the baby's gut to help strengthen the baby's respiration, all those things that Mika was just saying. You guys kissing each other, it's not just a cute little optional thing. We're programmed to do these things because it's about us staying alive.
Absolutely.
The baby needs to smell its birthing parent, needs to smell its mama. Mama needs to smell the baby. There's all this wonderful science going on behind the scenes of the beautiful picture of the Madonna and Child. There's all kinds of beautiful life-saving things going on behind the scenes that need to happen.
And we know that when you delay the bath, for example, that it increases rates of breastfeeding overall for people.
Yeah. Plus, I trust new parents to be very gentle and ginger bathing their little newborn. The kid's not dirty, so sometime in the first 2 or 3 weeks of life, they get to do this thing and post pictures on Facebook. And they're going to be uber careful. I've seen nurses take little newborns and stick their heads under running taps of water. Imagine you're a new little human being. You just came out of your parent. And this water whoosh, on your top of your little head, how scary that might be.
Mm-hmm.
It's insane. No, take your baby home.
Mm-hmm. All right, we're gonna watch a video, a birth story, and then after that birth story, we were gonna cover comfort techniques tonight, but we're at the end, so we'll move that to next week. But we'll finish with this sweet birth video, Brandy's birth story. Not as, I love the other, I love Deborah's the most, but got Brandy this time.
How do you fold those? They're so small.
Sorry, let me make this. Click on that.
Hi, I'm Brandy. I'm 37 weeks.
I'm Shane, Brandy's husband. Oh, I can't wait. And I can't wait for her to feel better again.
I'm like, I'm ready to be done with this, you know, and have my little baby. Having an unmedicated birth is really important to me. Women have been having unmedicated births for thousands of years. It's a primal instinct to bear down, you know, to get in the squatting position, to breathe through it and, you know, just allow the body to do what it needs to do. So I'm excited for that. Contractions started actually the weekend before that he was due, which was really exciting. So my labor support team included Shane, my mother, and then my doula, Molly. I flip more on this side. Early labor contractions that definitely felt stronger than Braxton Hicks. Some at one point I could feel kind of start at the top and kind of push down. It's just the weirdest experience. This is really the uterus actually doing its thing. Like right there. As we were timing them, it was like, oh, okay, they're pretty regular, because before they weren't regular. So we're like, okay, this is it. My doula, you know, she had come with a bunch of oils and stuff, so she was doing massaging, and that was nice.
During the early labor, to help Brandy with the contractions, I was just trying to, you know, suggest things that may help. Rubbing her back a lot, massaging her legs, her feet, just trying to keep her comfortable.
You know, then we did do some yoga moves and, you know, kind of doing some stretching, and so that did help. Other times it was like, okay, I just feel like dancing, just kind of sway. So I'd lean up against Shane.
I made the call to the midwife just to kind of get some clarity. Hi, I'm just calling to give an update on my wife's status with her labor.
Are you having one?
Yeah, hold on, sir.
Okay, so, well, yeah, I guess we'll just kind of keep counting and see how far apart they are. She basically said just, you know, kind of wait, but did, you know, tell me if I felt like I needed to go in, then just go ahead and go in at any time that I felt like it. So we waited. After the whole night of laboring and stuff, we decided, okay, let's go in. We started walking around the hospital, and it's like everything started feeling funny. Definitely mild contractions. It's hard.
There's so many emotions. It was, you know, fear and excitement, and there's so much going on. It was hard to describe.
And I realized this is different, you know, than from the early home labor stuff. So that's when after a bit, I was just like, I need to get back to the room and just be there. That was kind of like my comfort zone. Like, I don't want to be out walking around. I want to be in my room ready for whatever happens.
Is that pressure of your hips? So we're just opening the pelvis, okay? That's important. There you go. That's good. Is that okay?
Once I got into the tub, I was kind of like, okay, this is nice. I'm just kind of chilling, relaxing.
Mika got in the tub with Brandy just so I could be there with her.
You having another one?
She could lean on me. Sometimes those tubs aren't very comfortable, so it just gave her a little support.
I remember a few times Molly, you know, kind of talking, doing a visualization. You know, each contraction was just a wave, and she was like, just ride with it, let the water flow over you. I'm like, okay, I can do this. I'm just sitting there, I'm rocking with the waves, just rocking with the waves.
So from what I can tell, 5 to 5.5. Okay. Baby's head is really low. That's why you're feeling pushy, but we're not at the pushing place yet. So this is a good place to have you here in the tub.
When they told her she was at a 5.5, I was excited because I've always heard that from a 5 on really progresses and gets there pretty quick. So I knew that she was dilating more.
After a while, I was just like, I couldn't be in the tub anymore. Somebody had mentioned, let's get into the bed. So I was leaning up against the back of it, kind of, you know, rocking there, up and down, and kind of side to side. We had got the peanut involved. And then I was like, well, I don't like that. Let me see if I could drop down to the next level, and kind of moved around there.
And then you can just lean forward.
After a while, I was just so tired that I was like, I just need to lay down for a bit and rest. As each contraction came on, somebody had my leg and they were pulling it up towards me and just kind of rocking it back and forth.
It was interesting that she came up with that on her own and just like, okay, you know, do this. And, you know, she took control and made sure everyone around her was doing what they needed to do.
So in between contractions, it was just like that relief. It was like, oh my goodness, big sigh of relief. It's just like, I can relax now. That's a girl. Good job.
You know, I knew Brandy was getting close. I think she was about 7 centimeters, 7.5, somewhere in there. I wasn't much help if I was completely exhausted, so I figured I'd just take a nap and build some energy.
You just tell me if it's too much or if you want me to stop.
I felt the contraction coming on, and Molly was behind me, you know, and that I still had to keep that kind of squatting up and down movement. And then all of a sudden I felt her legs come in between mine to help support. So she was just literally holding on to me and helping me up and down because she could tell that I was starting to get tired and was just moving me through the movements. And I felt like an icky feeling. And so when it got to that point, I was like, I have to get back in the tub just to kind of cool myself back down and then just kind of get back into like a nice, relaxed state. I'm not even sure if I knew I was in transition. It did feel different then, just because it's like I could tell just like the wear on my body. Felt like a death grip on like the faucet and the bar and stuff. And then I remember the midwife like, let's check you again. So I'm gonna check you. She's the anterior rib, so she's 9.5. I was like, a half? Why? It should be 10. What is up with this half stuff? Nobody ever mentioned anything about halves.
I just knew it was go time. I was ready for it. There again, it was the whole rush of emotions, like when we first realized it was time.
And then midwife checked one more time. She was like, all right, you ready? And I'm like, heck yeah. Perfect. Now she's.
Keep it going, Brandy. One more.
You know, I rather wanted to do it in a squatting position, but I've been squatting and doing lunges and squats and everything else for hours and hours that once I was on that bed, I couldn't move.
Down your spine.
And I was like, everything's opening. This is it. We're so close.
When I first saw Hunter's head start to come out, I could see his blonde hair. I was like, oh my goodness, it's a real human being and he's going to be here soon. I couldn't wait to see him.
He's right there. Do you want to feel his head?
Oh, yeah,
And
you
you
definitely
feel
feel
his
his head.
See, there's
There
his
it
hair.
is.
Feel his hair. That's his hair. Yay! One big push. Out the bottom, not the face. Right there. You got it. Breathe in. Good job. Good job. Up we go. Lift him up. There he is. Awesome. Okay. Say hi, Mama. Yeah. Good. Trying to breathe.
That whole like, I don't have to do anything now. I'm done. I'm done pushing. Like whatever energy I have to just be here. I remember Molly, she's like, you want to start breastfeeding him? I'm like, okay, how do I do that? You know? Oh, it was like so surreal. I was like, wow, it's like I have my baby in my arms and he's eating right now. So, I mean, it was exciting.
Being such a big role in Hunter's birth was pretty amazing. It gave me a new view on life. Brandy's amazing. Like, she is absolutely my hero. Just seeing her go through that and just be so calm. Super proud of her. It's pretty amazing to have a newborn in the house that I can't keep my eyes off them. Just always want to hang out with them, check them out.
It's just wonderful waking up and like just looking at him and just like, wow, you know, I created that, you know, I birthed that.
That's a great birth.
Sweet, isn't it?
It's very well done. It's a hospital birth with a doula.
And a midwife.
And a midwife and a natural birth. It's really great. It's really, really great.
Well, thank you all. We'll continue next week. And Samsarah, did you want to?
Yeah, I'll just say a few things.
Yeah.
Real quick, and then you can actually close.
Sure.
So I want us to have a round of appreciation for Mika.
You're welcome.
Doing just a wonderful, wonderful job. And I also want to extend my thanks for everybody for being here. We have a couple of guests in there somewhere. I'm trying to look around and find you. So thank you for being here. If you have not registered, please send your name, address, and email and phone number to oaklandbetterbirthfoundation@gmail.com. If you have not made your contribution for the class is offered on a sliding scale of 100 to 250, but we know that times are tough, so if people need to pay less or if they need to not pay at all, we get it. But please send whatever donation that you can to our beautiful instructor at Mika Cade at Venmo. And doing that will help us to be able to continue to do these classes and offer them to more families. So we want to thank you for doing what you can, and don't feel bad if you can't do anything right now. You can send us a contribution another time and we'll take it then. Thank you. We have Spanish class for childbirth education coming up. Please look at the Oakland Better Birth Foundation's page. Please feel free to share that event. Kathleen and Christina, who you can see on the screen, are the instructors for that beautiful class. I'm very, very proud of it. I'm proud of all my wonderful doulas, but really happy that we can extend that for folks who are Spanish speaking. I'm wanting like Vietnamese volunteers next, and I want someone who speaks Cantonese. I mean, we need to teach this to everybody. So I think those are the main things that I wanted to say. If you haven't registered, if you haven't paid, please try to do those things. Even if you're not paying, please register so we know who you are. We can put you on our mailing list, and you'll be able to know more of what we're doing to support beautiful natural birth experiences, beautiful healthy birth experience, reduce mortality for all birthing people, but especially African American women and Indigenous women.
Thank you, Samsarah. Again, thank you all for being here this evening. I really appreciate it. I appreciate all of you. And if you have any questions for me, any follow-up questions, please feel free to reach out to me. My email is doulamika@gmail.com. Maybe someone, let's see, I can put it in. Thank you very much, Jessalyn. And and I'm so happy to have you here. See you next week. Bye.
Peace out, y'all.
Peace out.
Good night.
Bye. Good night.
Good night.